I'm back with Isa Herrera, who is a New York City-based holistic women's pelvic floor specialist and the author of Female Pelvic Alchemy. And she's been talking to us about all the various things that you can do as a woman to help yourself heal yourself so you don't have a lot of these issues that happen when you go through menopause. So, having dealt with all the people that you have, Isa, and people who have bought your books, who perhaps have been back in touch with you, what are the things that you hear from your, shall we say, your tribe?
I think, what I hear from my tribe, and I hear this quite often, is I didn't know that I can help myself. I didn't know that I can cure this. I didn't know that I can heal this, and a lot of women just don't know. So I hear that a lot. Then I hear, always, good words like, thank you so much for putting yourself out there. Thank you for being honest with your journey and for the inspiration. And then I hear things like, you want me to do what?
Well, I can imagine that too. Yes, yes.
And then I tell them, yes, I want you to do exactly that, So I think that it takes sometimes a little bit of understanding. So the first thing that I teach people in my book is actually what is actually down there. What's the anatomy like? You'd be amazed how many times I get a question from somebody in my class and they don't know their basic female anatomy, which I call your birthright to know this.
I probably don't know, Isa, because I've never really had to know. So
Yeah.
I probably am one of those people. Absolutely.
So I like to encourage every woman to really take out a mirror, right? Because it's like about feedback modality, and to really look and examine. I mean, we're encouraged to do breast exams, for instance, a monthly, but we're not encouraged to really look into our vulvovaginal area and find out what's going on, especially if there's symptoms that need to be addressed.
Well, this is true. And, you brought up and happen to be a 3-time breast cancer survivor. So I've had 16 surgeries. And interestingly enough, all of mine were caught on a mammogram. You never felt any lump at all.
Oh, wow. Okay.
Is there something that women can catch by observing themselves? I mean, is there something other than understanding your body parts and understanding what's there? Is there something that people should be watching out for as well?
Sure, absolutely. I mean, you could be looking at, especially at this age, a lot of women are having pain with lovemaking. You want to look at the integrity of the skin to see if it's cracking. Because of the dryness and the lack of estrogen, sometimes that does happen. You will be looking to see, and I teach this in my course, how to do a QTip test to see if there's any inflammation in the vestibule, right? In the inner part of the vaginal lips, to see if the dryness has affected the nerves, right? You will want to look to see if you see any lines, because so many women have had episiotomies and perineal tears, and you can do scar massages on them, right? And you want to look to see if there's any bumps or warts or any kind of tissue that looks really inflamed. Those are the things I would be looking for.
So how do you feel about hormone therapy?
Well, for me, I'm on hormone therapy now. So I'm one of those people that is on hormone therapy. I went through menopause immediately after I had my daughter at 41. No one can figure out why that happened to me. That's something that I've actually never.
Yeah.
Yeah. I've never shared that with anybody because it's funny you got that out of me, so that's good. And really no one knew why we're still trying to, even to this day, I try to figure it out. And I suffered for so long. I suffered not only with the postpartum stuff, but at the same time I was going through menopause, and not even perimenopausal, just went right into menopause. And I couldn't sleep. I had anxiety. I had all these kind of crazy things. And I forgot what book I read, this big guy down in California. I don't remember his name. And so I do, what I've done is titrated myself down to the bare minimum of what I need. And I downregulate my receptors once a month. And twice a year, I completely get off of them. And I do something called endobiogeny, which is essential oils that support my system. So I do a combination of therapies. It really depends on the individual's medical history, what they feel comfortable with, what their pocket can afford, because bioidenticals are expensive. Most insurances don't cover them. And whether, what your medical history is. So for me, if you need it, you need it. You find what works, okay? But I believe in making sure that you completely clean your liver out and stop the hormones for a whole month and stop the hormones for a whole week, which can be very difficult. So I don't believe in continual hormonal therapy, but that's just me because I want to make sure that, I'm checking myself constantly too for any signs of breast cancer and going for mammograms and dermograms. So it really depends on the individual. I'm not one of these people that says, don't do it. I believe that you should do what brings balance in your life. And if it resonates with you and you know what you're getting into, then you should follow your female intuition. So I don't have any dogmas or doctrines about it. I really believe that it's just an individual choice.
Very interesting, because I would think that, there are certain people that are pro hormones, biohormones, and people against. And, you wonder if the doctors really know what they're doing when they prescribe these things to you, because I'm sure there are people that have had much deeper training and education than others. But tell us now a little bit about what's in your book, the reaction you've had to it, what's in your course, how long it is. Give us a little bit about your resources.
Oh, absolutely. So my book has a little bit of everything, okay? It shows you how to care for your lady parts naturally, right? Different kinds of things that we should be doing and like not using soap. I know that's going to sound crazy, and staying away from chlorinated products, and what kind of lubricants are great for you. And I believe in, anything that you can actually eat, just stay as natural and as organic as possible. I have a whole module that actually really trains the bladder, because so many women suffer with bladder issues. And in my course, I just go really into great detail on how to retrain the bladder, because the bladder, as we know from our grandchildren and our children, can be trained very easily. And sometimes the bladder creates havoc on a woman's life. They can't even sleep through the night.
Well, that's true, I think. And that happens really at not only older ages, but younger ages as well. I'm just curious to know, when you talk about that, how do you train a bladder? I mean, that's fascinating to me.
Oh, absolutely. So the first thing that I teach, especially in my course, because my course is like the book but on steroids, we go through a whole bladder log. Okay, that's the first thing we do. Once you go, so the bladder module in my course is later on, because I want you to understand what's happening within your muscles first. So many times we have urgency or we have pain, and it's due to a trigger point or a spasm inside. And we can really actually work on that to normalize the bladder later on, right? Because the bladder is supported by the pelvic floor muscles. So if the pelvic floor muscles are in disharmony, it's going to create like a negative crosstalk to the bladder. So if you fix the bladder, but you don't fix the muscles, then you may always have a little bit of an issue there. So it's best to fix both. Absolutely. The other thing that I talk about is bladder irritants, like carbonated drinks are a big, huge irritant for the bladder that can make you want to pee all the time. Now, women who have this issue with incontinence, and I call it the bladder madness, sometimes stop drinking water, because they think the less water I drink, the less I'm going to pee. And that's not true. That's a myth. That's a bladder myth. If you don't drink enough water, you're going to have more irritation. You are most definitely probably going to wake up at night. Okay. And you may also have pain with when you're peeing, or you may feel like you always have a UTI. So I think water is one of those essential things that we must be drinking all the time as we approach menopause, because we want to keep our bladders and our bodies as hydrated as possible.
So you also think then that diet has a lot to do with this?
Oh, 100%. 100%.
So what suggestions in terms of diet?
Well, one of the suggestions that helps my patients a lot, first of all, is staying away from any wheat or gluten in the initial periods of when you're trying to heal your bladder and your vaginal muscles. I also suggest that you go dairy-free. It's very strict in the beginning as we clean ourselves out, and then we can reintroduce these products back into our lives. I mean, everybody knows, that you can have a certain kind of drink and it can, like a coffee, and all of a sudden you feel something in your bladder and you got to pee right away. So I do try to get women off coffee, but that's really hard, and they don't like me for that.
Do you believe, Isa, that I have never, ever tasted coffee? I've never had a cup of coffee in my life. I've never tasted anything coffee.
Oh, no, I don't believe that at all.
I know. It's amazing. I mean, just amazing. But yeah, I didn't mean to interrupt you, but people are amazed by that. Yeah. So do you think, you hear about these cleanses, where you go on these cleanses for 3 days or a week sometimes. Do you believe in those?
Absolutely. I believe, like, when you take your car to get the oil change, right? We do that a lot, right? We take care of the oil change in our cars more than we take care of the oil change in our bodies. Yeah, I think that there's certain times, especially when there's been a lot of toxicity in the system, or when there's been medication, or there's been exposure to opiates, or even like myself, someone who's on bioidentical hormones, you must clean out the system. I think it's just going to make you better. And then you have to really work with somebody who knows what they're doing. Every other person has a cleanse now,
I was going to say, right. Is there one that you suggest better than the other?
I believe in whole foods. I believe in organic eating. I believe in, I like paleo, but that's my thing, meats and vegetables and high fats. I also like juicing, but you really should be under the care of someone that knows what they're doing for the juicing. Because I've seen women come to me like passing out because they're juicing all day. And I'm like, what the hell are you doing? Talk to someone about what you want to do. Connect yourself with somebody who's really, who really understands this. But diet is like, food is medicine. And we should never forget that.
Well, I agree with you there, but when I was thinking of cleanses, I was thinking of the people who go on these, you just said it, juice cleanses for 3 days, or green whatevers, that they do.
Yeah.
But are those good cleanses or no?
I think it really depends on the individual and what they resonate with. You know what I mean? So for me, it's like, if you want to do a particular cleanse because you just read it on the internet, which is probably what's happening to the majority of America, I'm like, okay, how do you feel about that? Is this something that you can actually do? Some people they put themselves on a cleanse that is almost impossible to achieve, and then they beat themselves up because they can't complete the cleanse, right? So choose something that makes sense for your body. Choose something that you're going to at least try to enjoy somewhat, even though cleansing is never a happy experience. And choose something that you can actually communicate, even if you have to get like a one session with somebody who knows about cleansing, a nutritionist. Go out and seek expert advice. When I want to do something, I seek expert advice. So why not, if you want to invest in that, why not take it a little step further and do something that's safe?
Well, I totally agree. And of course, I know lots of people who do cleansing not for the reasons you say, but do it, to lose weight or whatever. And they are just as heavy as they ever were. And they don't seem to, change at all. And I just question sometimes, why are you doing this? Now, I can see it if someone is, doing it for a health purpose, but some people do it for, as I say, dietary, and it doesn't change them. It doesn't do anything at all. So I was just curious about that. So
No, no, no. I would agree with you. I think that the problem is that, you're going to go to a wedding in 2 weeks. So I'm going, I hear this all the time. After
yeah,
14,704 healings, I've heard every story you could imagine and then some. I'm going to a wedding in 2 weeks, Isa. I need everything perfect. I'm like, well, it doesn't work that way.
exactly, exactly. Well, because I think they get that from reading about the stars when they say they're going to, one of these award shows, and they've got to fit into this particular dress. So they go on this whatever for 3 or 4 days, and they get down there and they're in the dress, and the next day go back to where they were. Well, I mean, I guess that's where they picked it up from. I really think it came from the celebrities.
Oh, I think so. The media right now plays a mind game of women, especially on menopausal women, thinking that we are going to shrivel up and go stand on the sidelines and wear pea-proof underwear and panty liners and depend. And I'm here to say that we don't have to buy into that.
So, what other suggestions do you have in terms of the work that you do that we haven't talked about?
Other suggestions, like if you're looking for someone to work with, a pelvic therapist.
Well, it could be. I mean, I guess people could take your course and
Absolutely.
understand that. But I mean, are there other pelvic therapists around? I mean, I just have never heard of it.
Yeah, absolutely. There's not that many of us, but they are around. And one of the reasons that I created my online course was because there's such a need for this information. And most of the women, they tell me they don't have access to it, or they're too embarrassed to go and see somebody, or there's no one within a 20-mile radius of their home. So I think either seeing a pelvic floor therapist or taking my course, which is phenomenal, is something that women, it's like a checkup. I think if you go for your annual checkup, you should be checking yourself too.
I agree with that. I totally agree with that. Yeah. And,
Yeah.
Unless something hurts, people very often don't do anything about it. But I will say one thing. I think women are far more conscious of their health than men are. I think
Absolutely.
put it off forever and ever and ever. And women will go and get their checkups, and they will get their, because I'm always preaching prevention, and I'm always preaching, you may think it's not a necessary trip that you need to make to the doctor, but you need to do it, and you need to do it for prevention. And even though it may be costly, you need to do it. It's what keeps you going. So I'm a firm believer in that.
Absolutely. And I would love for every woman to take my class as a preventative measure. What happens is we wait too long. We put ourselves down on our own list, because I have women who take my class where they're perfectly fine and they just want to be better. They want to run better. They want to do their Zumba classes. They want to golf. They want to play tennis. And when I see them in my class, it brings me a lot of joy because I'm like, okay, there is a place for this work in preventative care. But it's just like they don't know, it's not, we wait until something is until hell breaks loose, and then we seek the care instead of knowing. And then a lot of women, of course, don't know about this kind of preventative care for female health because it's not well publicized in the media.
Yeah, I mean, truthfully, I had never heard of it. And so that's why I was so curious when the opportunity came up to interview you and to say, what is this? Because I had never even heard of this. I really never heard of even the pelvic floor. And I consider myself a fairly educated, well-rounded person, and I'd never heard of it. So I thought that was just very, very interesting. So well, you said the youngest, you were 41 when you went through menopause. And
yes.
Yet you said you have women who are 86. So is there any kind of commonality in terms of when this is most happening to most women?
I said the commonality would be in the menopausal, right when you hit that menopause and the estrogen starts to dwindle. And the commonality would be probably in the childbearing years when women are having one baby after another baby and not taking care of themselves because they don't know, they don't have the information, or they feel like the one thing is just because something is common doesn't make it normal.
Yeah, I'm thinking of the people who were on television who have 17 children or something like
Oh,
that. And
I don't even know what that's like.
yeah, I can't. I mean, and until the very last one, she really didn't have any issues, or even like Ethel Kennedy in the time when nothing was talked about. Had what, 11 children or something like that? I mean, I can't even imagine all of that. So, um, and interestingly, with me, I kind of forced my menopause. I got to an age, I think I was 49, and my gynecologist said to me, there really isn't a reason for you to continue with your period. And I thought, okay, not that I liked it anyway, I certainly didn't care. And
Right.
so, he did a D&C in me, and I stopped. And I used to have a very heavy period.
Oh,
So
okay.
I was very happy not to have it anymore. But it wasn't, but then when that happened, of course, I did go through menopause, but I did not go through it with any of the things you're talking about. What I went through was standing on stage and the sweat pouring down my
Oh,
face.
yes.
And when people would come up to me and ask me a question, I was just, I mean, I was just, you couldn't believe it. And it was very embarrassing because, I mean, you don't want to stand there talking to somebody and have the sweat bearing off.
Yeah.
But now it's talked about all the time. So it's
Oh,
kind of a
yes.
different era. But that's interesting. So do women come to you before menopause?
Yes, absolutely. I have a huge population of very young women that come to me. A lot of them typically are very athletic women who are training so hard, doing things at the gym so hard that their vaginal muscles are almost like seizing up on them. Okay. And when that happens, they complain of the same things, ironically, that the menopausal women complain about: leaking, lack of sensation, you know, heaviness in the pelvis. And you would think that you're seeing this young woman, and she's like the radiant picture of health, yet her lady parts are a big mess. And I'm thinking, well, wow. So I have a huge in my practice, tons of young women who come to see me for these conditions that we think are something that happens to older women only. So that's also a myth. The pelvic floor muscle knows no barrier and knows no age.
Wow. Well,
Yeah.
so where can people find you, Isa? How would people find your book? How would people find your course? How would people find you?
Absolutely. Thank you for asking. I really appreciate that. You can find me at pelvicpainrelief.com. That is my portal page, where I have all my courses and I write beautiful blogs. You can get on my list. I'm big on education. And you can find my books on Amazon because I self-published my books because I thought that was the way to go. And they're all really, selling very well. So you can find me in one of those two places. In New York City, well, you can call me at my practice at Renew Physical Therapy because I always like the name Renew, like renew yourself, renew your hope, renew, I don't know, I just like that word. So I use that for my practice name.
So
So that's where you can find me.
so the best way, if they're not in New York City, website is pelvicpainrelief.com.
Hmm.
And the book is Female Pelvic Alchemy. So those are
Yes.
the places you can find Isa. It's Isa, Isa Herrera. And this has really been very educational and interesting, Isa. I want to thank you for
I
being
want
with
to
us. And I know that our listeners will have a lot of learning from today. So thank you so much for being with us.
Thank you so much. I want to thank you from my heart because I really believe that women should have this information. So when I got this opportunity, I was like so super pumped, and so I'm very grateful. Thank you, Dr. Kale, for doing that.